Hey everyone, welcome back. I'm Dr. Shayna Keller, a registered naturopathic doctor in the state of Colorado, and today we're going to be talking about hiatal hernias, Hiatal, hiatal hernias. With that, we're going to talk about the most common types, the 3 types of humans I generally see with hiatal hernias, which are not what the conventional practitioners talk about most frequently, how imaging doesn't always catch it, and a couple things that we can do to treat it functionally without having to have surgery. Now, we're going to jump right into it, but I just want to give the caveat that sometimes we do need to have surgery. I personally have opted to not do surgery for mine, and I treat my patients as such as well. If it's a giant hiatal hernia, then we need to consider another option, but no one's talking about this, and this is really good information that you need to know about if you have a hiatal hernia. So let's get into it. So what is a hiatal hernia? All right, I'm going to show you an image. I'm going to show you a sock because I feel like it's the best way. The stomach is a J-shaped organ, okay? And it kind of sits right below this is the esophagus right here, and then this is the lower esophageal sphincter, okay, where my fingers are. This is the part of the stomach that actually churns inside and out. It has 3 layers of muscle, and what's important about that is if this sphincter is not closed, you're going to leave this open. What's going to happen? The stomach can pop through. So we're talking about a sliding hiatal hernia, which in my opinion are the most common, as opposed to the ones where what are they called? Paraesophageal hiatal hernias, where they actually pop through the diaphragm in a separate place than the hole that our stomach comes through naturally, okay? So what are the causes of this? Conventional wisdom says it's people that are overweight, it's people that smoke, or individuals that have been pregnant in the past. I do see pregnancy as a big common cause. However, most of my patients that I see, and obviously myself, I'm not a smoker and I have never been overweight. So then what's going on here? Why is this the common cause that conventional wisdom says? Yes, smoking does not help. Smoking rises, and what is a hiatal hernia? It has slipped, your stomach has slipped up into your esophagus, rising up, right? And then having a little bit of extra visceral adiposity, visceral fat, that puts pressure on your abdominal cavity, and that kind of pushes things up as well. So, but what about those of us that are thin-framed humans and we have this problem? And that is by far the most common type of individual I see in my private practice and what I've seen as a student when I was still in clinic. Type A, high nervous system, like kind of runs on high energy, and I'd put myself into that category as well. So what is kind of physiologically going on here? So we have the abdomen where all the viscera, the guts, the liver, the small intestines, the stomach live. And then we have the thorax, the upper part where the chest, where the lungs and the heart live. So these 2 cavities are pressurized differently in our body. And I always give the example when I'm talking about this to my patients, hey, we've palpated or we've felt a hiatal hernia on physical exam, which is so important. And we'll talk about why here in a minute. When we watch a scary movie, what happens? We pull in and we never let that out. So what we're doing physiologically is we are pulling our abdominal cavity up into our thorax. That creates a problem with the pressure balance that we have. And I'm not going to be able to remember all the dirty details of the pressure, and I won't want to bore you with them anyway. So what is important here is I'm saying that the most common cause of a hiatal hernia is nervous system dysfunction. And I know, buzzword, people don't like that, but it's where your nervous system gets a little bit like out of whack because you're used to running on high all the time. So one of the most valuable treatments I see, you got to stick around because it will change your life. And I actually just got a message from a former client that went through my program, the reflux relief method. And she's like, I am 99% better. And the thing that helped the most is paced breathing. And we'll talk about the details of that in a minute. So, 3 types of people. So we've got the type A, the thin-framed, high energy. We've got the second type I see is like middle-aged men in their about 40s, 50s, 60s. And they really haven't been, this is more of the conventional, like the guy that like hasn't really taken care of themselves. They're having like a midlife crisis because all of a sudden like their friend just died and like they got diagnosed with this problem and they have high blood pressure and cholesterol issues, That is definitely a person I see, although far less common than it doesn't really matter the age. I've seen them as young as 15 with hiatal hernias and all the way up to 77, I think, was the latest person I just palpated a hiatal hernia on. And the third type is people that have been pregnant. And this makes sense. Why? Because when we get pregnant, we have relaxation that happens. All of our tissue relaxes, so that when we push out a giant watermelon outside of our vaginal cavity, that can actually happen, which is important. But the problem is a lot of times our tissue stays a little bit more lax, and that creates this propensity then to have a sliding hiatal hernia happen. So what do we do about this? And I wanted to talk about imaging real quick and why imaging is not the best way to diagnose a hiatal hernia. When you get an EGD, an esophageal gastroduodenal scope, a camera down your throat, you have to be under anesthesia. Anesthesia relaxes your nervous system. That causes the hiatal hernia to be transient or come and go, which is true anyway, even of a person that's like walking around day to day. Like if today has been a really good day for you and you're not having that crushing stomach pain or a little bit of reflux or silent reflux symptoms, which we'll talk about in a minute, it's not going to be a problem. But then maybe tomorrow, you just heard about your in-laws getting in a car accident and you watch this horrible thing on your favorite drama TV and you're just feeling a little bit more tense and like high strung about something. It's going to hurt because you're kind of like holding it together, wincing and like squeezing. And again, creating that pressure difference between your abdomen and your thorax, pushing your stomach up. So some of the symptoms, I was alluding to some of them. And in my case, it was very specific. I had pain directly at where my stomach lives, which is where your two pieces of your rib cage come together, kind of here, and then right here, there was direct pain, and we call this the epigastric area of the stomach. It's above the stomach. That's what epi means, above the gastrum, above the stomach. Now, and I had seen who knows how many doctors at that point. I had mini imaging, multiple EGDs, barium swallows. Never once did someone do physical exam. So this is why I'm really passionate about this and why it's so important that you get to see a practitioner that understands how to do a proper abdominal physical exam, okay? So you can have the pain, you can have the reflux, but actually what I see is more common than having the pain and the heartburn or acid reflux like I had. I actually see silent reflux symptoms be far more common. I kind of think about it this way. You've got a fist that is being jammed up into your chest. And that makes it hard to swallow. It makes it feel like you've got a lump in your throat. You can produce excess mucus because your body's compensating for having a little bit of that heartburn, reflux, even though you're not feeling the traditional symptoms of reflux. Postnasal drip is heartburn until proven otherwise in my mind, and oftentimes is associated with hiatal hernia. This is a really interesting thing I hear often, and it really boggles me. Oh yeah, you just have a little gastritis on your EGD exam. A little gastritis, and that's normal. Gastritis is not normal. Gastritis is inflammation of the stomach lining, okay? And this brings to the point the fact that you're having nervous system dysfunction because the mucus that your stomach cells produce to protect the lining of your stomach that keeps you from having something like gastritis or H. pylori infections, is only produced when you're in a parasympathetic state, a rest and digest state. And if you're used to running go on high energy, you're drinking maybe a little bit too much caffeine, I know we talked about people not smoking cigarettes, but I just want to paint this picture for you. You're not eating, you're running around like a crazy person, think about a lawyer, and you're drinking coffee and you're smoking too many cigarettes to like suppress your appetite. You're kind of getting the idea of like a harried, like rushed, hurried individual that's trying to go, get things done. The problem with that is if you're never resting, you're never going to be able to be properly digesting, and you're literally going to start hurting yourself. We need that mucous membrane to protect our guts. Now, how does H. pylori play into this? Because I see this all the time. Well, you just need triple or quad therapy, which are the conventional treatments for H. pylori infection. And I'm not saying it shouldn't be treated, but I'm saying we need to be a little more judicious with our use of medications. And I'm forgetting the medications that are in triple versus quad therapy, but it involves proton pump inhibitors, antibiotics, and I believe Gaviscon is in the quad therapy. So Gaviscon's not the worst medication. It's a mucus coverer, kind of like coats and soothes. I'd rather use marshmallow or slippery elm or licorice because they work a lot better without the side effects and you actually get to digest your food. So we're talking about nervous system dysfunction and the mild gastritis finding that is oftentimes on a scope. not a normal, just because it's common does not mean it's normal and healthy. I don't care how old you are. I don't care how young you are. That is telling me that we need to investigate the possibility of having a hiatal hernia, which only can be found on physical exam because anesthesia relaxes the nervous system, okay? Thereby letting that stomach relax down back into the abdomen and not having it pulled up like this. Pulled up, like if this is the stomach, this sock bottom part, and this is where the sphincter is, and you have that popped up, the sphincter can't close and the stomach is popped up into there. We have these really complex hormone cascading that happens. That sphincter closes and it tells the body, okay, we're producing more gastrin, which is a hormone that says make more stomach acid. This is exactly how proton pump inhibitors work, is they inhibit the cells that produce they inhibit the cells that produce the stomach acid, and gastrin goes up and up. This is why we have rebound hyperacidity when we stop taking proton pump inhibitors. I actually recommend a 12 to 16 week weaning process. That way we don't have that, so that the hormone gastrin can come down. Because what happens is when we're taking something that's saying turn off, the brain is going to say, hey, we need to turn this up because the body is not responding. So we get gastrin levels through the freaking roof. Okay, so let's circle back to H. pylori. I didn't finish that thought. H. pylori is a commensal bacteria that lives in our gut. But like a lot of other commensal bacteria, they can overgrow. H. pylori lives in the stomach lining. It likes to live in the mucosa. But if there's no mucosa, then it's going to take it's a spirochete, so it's a spiral-shaped organism like Lyme disease or syphilis. So it kind of gets a bad rep because of that. And it's really... You're never going to kill H. pylori, and I know people are going to be upset about that, but the reality is it's a commensal bacteria. We just need to knock it back down and get it into its place so that it's not overgrowing and causing an increase in pH in the stomach and causing stomach ulcers, drilling in to the stomach lining without the mucosa there to protect the stomach lining. Okay, so we're talking multiple factors going into here. You see gastritis, you need to be assessed for hiatal hernia. Who do you see to get that assessment done? Either a good naturopathic doctor that's well-versed, a chiropractor sometimes can be, and occasionally you'll get physical therapists that have training in something called visceral manipulation, which we're going to talk about a couple techniques, and one of those will be a self-adjustment. So let's actually talk about that. We kind of talked about symptoms. So we're going to pull up an image of the anatomy of the abdomen, and I'm going to show you how to do this adjustment yourself. In my opinion, it's a little bit easier to have someone show you in person, so you kind of get a sense for like the depth that a person's going to go, but it's an easy enough thing. You're not going to hurt yourself unless you have extenuating, like, I don't know, maybe you have shrapnel metal from being in the military, or I don't know, always consult with your doctor before you try anything some random person on the internet is suggesting, but it's an easy enough treatment and it's pretty safe. So, all right, so what you're going to do is you're going to take these fingers here. I usually use my ring finger and middle finger. You find what's comfortable for you though, okay? And you're going to find this part of the, where your ribs come together, and you want to scoot down maybe an inch. And what you're looking for, what you're going to feel for, you want to relax. I don't know if you can kind of see, I'm sitting up straight and I'm kind of slumping over, letting my fingers kind of slumping over my fingers. And what we're going to do here is you're going to feel, and yeah, my hiatal hernia is out a little bit. So I'm feeling for taut like a trampoline or soft like a ball of dough if you've ever made like homemade pizza dough. You want it to be soft. That's the normal tension. If it's feeling taut, it's because your stomach is a little bit pulled up a little higher than it needs to be. And on the image, you can slightly see the stomach, and it's in a healthy position there. So it's actually down into the abdomen. What we're looking for with this adjustment is you hooking your fingers on to what we call the lesser curvature, one side of the stomach, and you'll feel this. We're going to go a couple inches deep in how this adjustment works. So put your fingers there about an inch below the end of your sternum or your chest bone. Take a breath, bend over it, take a breath in and out. And as you're doing that out, you're going to sink in a couple inches, and it's a couple inches, like 1.5 inches to 2 inches, and it does not feel good. That's a good thing, okay? And then you're going to take another breath in and out. And on that out breath, you're going to gently tug, but firmly, down into the left along that left rib cage piece, okay? And pull. And you might get some gurgles like I just did. You might feel like a little pulled pop down. You might feel nothing. Oftentimes, if this is the first time you're doing the adjustment, you will need to do it 2 and 3 times. I recommend not doing it more than 3 times because this is a sensitive area. Okay. So then you reassess. Okay. It's feeling a little bit less tense. I felt the gurgle. I know for myself that 1 adjustment is plenty. The other thing that's really important when you're doing this self-adjustment is if you take some deep breaths in and out through your nose, not through your mouth, in and out through your nose. 2-3 rounds of those breaths to relax your nervous system, because what did I say? The most common cause of a hiatal hernia is nervous system dysfunction, us running in sympathetic mode like a crazy person a little bit too long, and that causes some tension in our belly, specifically with our stomach. Okay, so I don't know if there's a specific name for this. I learned it from the naturopathic doctor I saw, and then I took it upon myself to get additional training through the Burrell Institute for visceral manipulation. And really, we're super lucky here in Montrose, Colorado, to have a visceral manipulation practitioner who is good friends with Pierre-Jean Burrell, who is the guy that wrote the book on visceral manipulation. He's a traditional osteopathic doctor out of France. It's unfortunate that most osteopaths in the United States today don't really learn manual adjustments. It's a lost art, and it's very powerful medicine, in my opinion. And any of you that have seen a DO, you've probably never been touched by them, which is awful. You know, I remember seeing one and I had like a headache that was a tension headache, which I didn't know at the time. And instead of the doc actually like touching me and saying, oh, you got a tension headache, send me for an MRI. So this is the problem that I'm seeing with these types of more functional conditions like a hiatal hernia, is we miss things because we just do blood work and imaging. I love blood work and imaging. I'm very liberal with imaging. I think it's very important that we rule out the big scaries, and that's what imaging gives us. There's no cancer, there's no ulcers. We can do biopsies at the same time, so we can run for H. pylori or celiac, right? Like we can rule out a lot of things. So I think it's a very valuable tool, but there is no replacement for physical exam with your hands, people. This is why I'm not worried about AI taking my job, because I don't need a machine to tell me what my hands can feel, what I've learned clinically. Okay, so kind of rolling back here one bit, you can have a very small hiatal hernia, 1 centimeter, that's measurable, and it can be the most excruciating thing in your life. Okay, I'm talking pain every day that's constant. You're losing weight because you can't eat, because you're having reflux. So this is something that can be very severe, and it can also be super minor. People can have hiatal hernias and have no symptoms at all. Problem is silent reflux and esophageal cancer, esophageal cancer is on the rise. It's rising faster than breast cancer rates are here in the United States. And my suspicion is because silent reflux is more common than your traditional heartburn symptoms. And silent reflux, we talked about earlier, difficulty swallowing, lump in your throat, postnasal drip. Okay. So let's talk about the paced breathing. That's where I alluded to earlier with that client of mine that sent me a really lovely email. She says, I'm 99% better. She's gained the weight back that she lost because she's actually able to eat, because she's calmed herself down. Paced breathing is, I usually recommend people download an app called Breath Plus. It's a free app. It's pretty easy interface. Unlike some of the other breathing techniques that you may have heard of, like Wim Hof, where you're going to have really long pauses and holds, there'll be no pauses and no holds. What we're going to go for if you download that app is 5 seconds in, 5 seconds out, 0 seconds for pausing at the top of the breath, and 0 seconds for pausing at the end of the breath. Why are we talking about breath work when we're talking about the stomach being in the wrong place? Because there is diaphragm, the muscle that sits, and it's a pretty big muscle too. It separates your thorax from your abdomen. And what have we talked about previously? That we're having a pressure differential issue from us being a little bit too high strung. And this will be helpful for people that have been pregnant and are experiencing hiatal hernia or reflux symptoms still, even years after postpartum. So what we're trying to do with the paced breathing is like lifting muscles and strengthening our biceps so we can have really buff arms. We're intentionally breathing in and out through our nose, not our mouth, so that we can actually get regulated breaths and start to tonify or strengthen that diaphragm. Okay, so we're paced breathing, 5 seconds in, 5 seconds out. How long do we need to do it? What I learned from my biofeedback instructor, Dr. Brad Lichtenstein, was 20 minutes twice a day. There has been new data that's come out since then, and it's 12 minutes. 12 minutes a day is the minimum you need to have the benefits from paced breathing exercises. Really awesome. I even struggle doing 20 minutes twice a day, and if you can get there, even better. But I always try to find that like compromise. Where can we get the benefit without having to do more work? Because I know we're all stressed and la la la. And there's like this old quote that's like, oh, if you're too stressed to meditate, you need to meditate for 15 minutes, you need to meditate for an hour, type of a thing. We all can find a way to make a little time, especially if you're dealing with a hiatal hernia and you don't want surgery. This is going to be a mainstay of treatment. This doesn't just like, you don't do it for a week and you're done. You don't take a PPI for a week, at least not in most of the patients I've seen. I've seen patients taking proton pump inhibitors, even though the box says no more than 2 weeks, unless told by a physician, up to 20 years. A little bit too long in my personal opinion with the side effect profile that PPIs have, proton pump inhibitors. Okay, so paced breathing. 12 minutes is the minimum. If you can do it 12 minutes twice a day, kind of like in the morning and in the evening, even better. And again, you can find it, they say sitting, whatever, lay down. Lay down to start is always easier to get your body to relax and get the maximum benefit. As you start to work on this, say you've been paced breathing 5 days a week for a month. I always try again, like that 80-20, it's 5 to 6 days a week. If you're doing it most of the time and you're being as consistent as you can, you're going to reap benefits. So that's what I aim towards. Perfection is not what we're aiming towards because my type A type of people tend to be on those perfectionist side. So listen to the tone. Don't watch the visual that comes with the Breath Plus app. Listen to it. It's much, much easier for your nervous system to relax when you're listening as opposed to watching this thing on a screen, and a little bit hyper focused is what I've found. Okay. And especially during difficult times is really when you want to pull out this paced breathing. What's really great is you're actually training your body in a non-stressed time to when something happens, you get a phone call that someone you love was in a terrible car accident, or you watch something on the news. We just passed 9/11 and any of us that were alive during that time, we all remember exactly what we were doing during that time. And instead of like holding our breath and freaking out, we go into this like, okay, I'm going to start breathing in a calm way so that I can be rational and logical in my approach. And we can cry about this in a minute, but we need to like make sure everyone's safe right now in this moment. Okay. Now, there's some other exercises that we can do, but these are the 3 that I have found to be most effective. The last one I want to talk about is the Fumaria officinalis. I forget what its common name is, but I usually just call this plant Fumaria. It is a plant that helps to tonify or strengthen that LES, which is what we talked about here, the sphincter that's between the esophagus and the stomach. Okay. There are actually many herbs that we can do this with. What's really great about Fumaria is there's been some studies that show, and I usually use tincture of it, finding it loose leaf herb is very difficult to find good quality. Definitely better to find someone that has made a tincture of it. This is not an herb that you're going to be able to find at like natural grocers or Whole Foods. It's one of those like weird niche herbs that you need to get from a professional like myself. 5 milliliters, 3 times a day. There was actually a really great study published in the Townsend Letter of a older gentleman from some colleagues of mine, and he did that dosing, and within days, and this man had been on PPIs for decades, he saw a resolving of his symptoms because he had a hiatal hernia, which no one assessed him for, like that's the tricky thing is like, you're kind of hearing the same things. Like you need to see a practitioner that understands functional assessment of the body rather than just like, oh, there's no frank problems here. It's not an overt, like 10 centimeter big hiatal hernia. Remember, small can be just as problematic. Again, okay, so we've got the self-adjustment, the Fumaria, and the paced breathing. The other thing I've alluded to is like finding a visceral manipulation practitioner. This is so important. I literally can't say that enough. You can do all the head things. You can learn about the anatomy and the physiology and how this works and wean yourself off the medications. But until you're actually getting the body work, especially for those of you that tend to be on the higher side of existing in life, I will often joke like normal people are at a 5 and I'm at a 7 and, I don't need any more fuel in my cup. And there's a lot of people that resonate with that. We live in a society where go is, oh, here's your nice reward. You're like an overachiever. You overwork, you stress yourself out. You don't take time for yourself. The problem is you're burning your body out. Your body needs those mucosal membranes. So what does visceral help us do? Visceral manipulation helps to teach us how to regulate our nervous system. by being with another human. This other human that we're with, generally body workers are pretty grounded humans. And so them showing up with their nervous system in a more grounded state and doing a little bit of adjustments in your belly, which I'll be honest with you, don't always feel good. And sometimes that gets the lymph system moving and you feel kind of like crap. Usually that's only the first visit. And way I recommend visceral for my patients is I need you to see a practitioner once a week for 6 weeks, and then once a couple times a month thereafter. And so by doing this kind of like, we're going to see a person once a week for a period of time and then kind of maintenance thereafter. It's like I go see my visceral guy every few months, like when I first started seeing him, I saw him every week for about 2 months. And then it was, it's been a little while. I'm going to get back in. Like this is a lifelong, it's not like a once and done, you take the ibuprofen, call it good. This is how we manage this condition if you don't want to do surgery, which again, I generally don't recommend the Nissen fundoplication because, and let's show you here what happens. But basically what they do is they take the top part of the stomach and they wrap it around to make a tighter lower esophageal sphincter. The problem with this is they don't count for the movement of our organs in our belly. Most conventional doctors, most medical doctors don't understand this. I had the privilege of having lunch with a medical doctor, a retired DO who was a general surgeon, which his surgery, just so, we got together for lunch and he's like, oh yeah, my favorite thing to do was a Nissen fundoplication. And I asked him about the rates of failure. And he was like, well, yeah, but not me because I'm a DO and I understand, an osteopath, understand that the body has a rhythm. Things move in the body. We are dynamic. We are not static. What I remember learning in school is like 50% of what we learn in a textbook is not what it shows up in the body. People can have extra veins, extra arteries. The flip-flop of the organs on the other side of the body is not super common, but it does happen. We have to allow there to be space for the body to be dynamic. That is just how it is. Like, we're not the same when we went to bed was when we woke up this morning. Like, our body hopefully got some restorative sleep so that we can produce more of those mucosal membranes. And, what we put in our mouth can change our microbiome in 24 hours. So if you're used to smoking cigarettes and eating coffee all the time and never actually putting food in your mouth, you might not feel hungry. And I've actually gotten people's... Anyway, I'm getting off on a little bit tangent here, but the purpose is the body is dynamic and we need to allow there to be space. So this general surgeon brought to my attention that he does not have the same failure rate, or at least when he was practicing, because he's retired now, because he understood that movement. What I see most frequently is you need at least one repeat surgery in 5 years, if not a second one in about 10 years after that second one. So we're looking at 3 major abdominal surgeries, to get things fixed. So it's the same. Like, do you want maintenance? Do you want to actually be participating and be empowered in your own healthcare journey? Or are you wanting to outsource? And I'm not judging you there. I've chosen that I want to do the self-adjustment because it's not that big of a deal. Some people's bodies don't respond super good to surgery. I'm glad that it's an option and I'm glad we have it there. And there's also this other world. We don't just live in a box. There's not just surgery and pills that are available to us. I do find that herbs and nutrition and nervous system, these lifestyle mindfulness techniques are far more beneficial than going and jumping into surgery because did you actually solve the problem that caused you to be a little more on the stressed side of life? No, you didn't. That piece was not addressed. I bet you the surgeries would be more effective if we did all of the things we've talked about here and did the surgery, because we're addressing the whole person as an individual instead of just like, oh yeah, everybody that has a hiatal hernia just gets this surgery and that's it. We're not addressing the fact that maybe you live in impoverished conditions and it's really stressful that you're working 3 jobs and caring for your family, right? Like, that's a big component that needs to be discussed. And if there's a way that we can help that person find more resources to reduce their stress, find a better daycare for their kids or whatever, I know that's not fully my job, but like, it's my job to take that into consideration as a naturopathic doctor because it affects the quality of your life. And if we're not doing those, we are missing a big part of the biopsychosocial model of healthcare, which I do think we're moving more towards in the conventional realm. Very few of my medical doctor colleagues I hear talk about this, but I am hearing it more frequently, so that gives me hope. Okay, so anything else that I wanted to talk about? Oh, one more technique. I actually don't find heel drops to be as effective as the self-adjustment, but people get weird about digging into their belly. That's why I put up that image, so you can see, like, you're not actually going to hurt yourself. You have to be, I don't know, doing something really weird to actually severely damage your guts. Heel drops, you've probably heard about, you've probably read about. What's really weird is there's an inconsistency in the amount of liquid a person needs to drink. I find heel drops to be more effective after you've done a couple nasal breaths, 2 or 3 of them, to relax your nervous system. Or you can do some, SCM squeezes, calm that vagus nerve, get things a little more settled, do the visceral manipulation self-adjustment that we talked about, and then do heel drops. That kind of like pops everything down. I have a video on my Instagram channel that I just posted, so I'm not going to belabor with going through the process here, but basically you drink 16 ounces of water and you chug that water. I don't generally encourage this, but the purpose of that water is to like get it into your stomach so that you can use that as kind of like gravity to pull things down, kind of get that same kind of pop. And you get up on your heels and you drop down, like you put your full body force down and you press down into the ground. And again, we're trying to force that stomach out of the thorax, out of the lower esophageal sphincter. Okay, so let's review. Hiatal hernias are more common than conventional practitioners are suggesting because imaging causes hiatal hernias to be transient. The anesthesia relaxes the nervous system and allows things to not be caught on imaging. The most common type is a sliding hiatal hernia, as opposed to the ones that kind of pop through the diaphragm in other locations besides the hole that the stomach the esophagus naturally drops through. 3 types of humans I see. The type A, go, fast-paced, the middle-aged man that hasn't really been taking super good care of themselves and kind of everything in their health is coming to a head right here at once. That's your more typical, like, I smoke, I'm a little bit larger bodied, and, anyway. And then people that have been pregnant previously or are pregnant currently. Everything relaxes. Small hiatal hernia can still be problematic. The 3 treatments that I find to be the most effective, fumaria officinalis, the visceral manipulation self-adjustment, and the paced breathing. Those are the 3 most high level, most important things. I've given you these tools so that you can help yourself. Obviously, the herbs are a little bit trickier to get, but if you know an herbalist or you know a naturopathic doctor, get set up with an appointment with them so that you can get access to that really good medicine to help start tonifying. If I had to pick one of those, the problem is you've got to get that adjustment. So a self-adjustment with the paced breathing. Like the herbs are extra, the self-adjustment and the paced breathing are not super sexy. People like when you throw herbs and like, oh, this fancy supplement and whatever. But there's a lot that you can do yourself that you don't need another person for. And lastly, finding a practitioner that uses visceral manipulation. Just Google, if you live in Nashville, Tennessee, visceral manipulation practitioner, you'll be able to find someone in your area that does that type of body work. Okay. And generally the credentials I look for is the Barrel Institute, BARREL. Okay, internationally recognized for training. So if you guys found this video to be really helpful, please leave a comment. I respond to my comments, and subscribe to my channel. We're talking about all kinds of different things on this channel. Hopefully I'm going to have a Cherokee medicine woman on my podcast soon. I'm really wanting to be inclusive of the various ways that we can think about health outside of the surgery and pills box, because there is so much that we don't get offered when we go see the doctor and we just get diagnosed with chronic kidney disease. Did you know that that's reversible to an extent, and making sure that you're on medications that aren't harming, etc.? Like, just another way to think about things. Please don't lose hope if you are diagnosed with a condition that feels really scary. The way I talk to my patients is when they go see their specialist, hear what they say, but don't listen to them with your heart and soul. Okay. And I'm not trying to provide false hope, but I have seen some very cool things, and I've barely been in practice for 3 years. The body is fabulous. It wants to heal. My channel, the purpose here is to provide you guys with other resources to think outside the box so we are not stuck. Thank you so much for your time.